This is Christine Bailey, Executive Director with Health Services Advisory Group. The purpose of this short webinar is to walk you through the process for completing the Culture of Safety Assessment for Health Services Advisory Group Hospital Quality Improvement Contract, otherwise known as HSAG HQIC. Our goals are to discuss the importance of assessing the safety of culture in your facility, identify why HSAG HQIC selected the IHI tool, review the completion process in the HSAG Secure tool, and identify the process we will be using to evaluate and monitor hospital progress. So let's take a step back that will help us look at how we got here and why we're focusing on culture of safety. In 1999, the publication To Err is Human was released, and it really triggered a shift in focus to creating a culture of safety in hospitals, really focusing on preventing harm. 20 years later, we are still faced with issues of preventable harm, and it remains a top major concern in the U.S. The WHO shared that globally 4 in 10 patients experience harm in healthcare systems. Also, 80% of harm is preventable. There's been several publications and research out really linking the improving the overall culture of safety to reduce patient harm and improve outcomes and improve quality of care. So let's take a look at why HSAG has selected the IHI Assessment Tool. So it was developed by IHI, and it was a group of subject matter experts that put the tool together. And we're really using it to establish a baseline for the culture of safety and the infrastructure in your hospital. And focusing on improving that culture of safety is a great way, especially for small and critical access hospitals, to simultaneously reduce all-cause harm. And it really integrates and it incorporates principles of safety across the board and high reliability. When you complete this tool and we continue to reassess throughout this contract, it will help us measure progress in overall patient safety. And it will also help us look for potential correlation between the progress your facility has made in improving the overall culture of safety and the amount of harm you were able to reduce. So this is a picture of the assessment tool, and the link is at the bottom. I really highly recommend that you download this tool and take a look at it. I would pull a team together to look at the various areas. They're in culture, leadership, and governance, patient and family engagement, workforce safety, and learning systems. And I think it's really important to have several opinions and views when you complete this, so that it is really as realistic as possible. And it will help us to be able to drill down and narrow in on the areas that we can collaborate with you and help support your improvement in the culture of safety. I think it's really important, to have that group think and to be able to have multiple people weigh in on this from multiple areas of the hospital. When you're ready to complete the survey, you can access the link that's highlighted here. In addition, your quality advisor will share with you a de-identified username. You can enter it in the box and hit Begin Survey. Completing the assessment is actually very simple. Just read through the question and the answers and select the question by clicking on the little circle of the answer that most aligns with the level of implementation at your facility. Complete each of the 4 sections. Under patient and family engagement, you'll see a separate call-out box, and In this box, we've incorporated the Centers for Medicare and Medicaid patient and family engagement focus measures. So again, simply click on yes or no. If you want to go back and change something, there is buttons to the right to clear your answer. So as you're completing the assessment, you can toggle back and forth between pages by using these navigation buttons to move to the next page or revert to a previous page. When you toggle back and forth, you don't lose any information. In addition, you can close it and log back in. So you can complete this in more than one session and it will save. However, I do want to caution you, when you get to the last page, if you click that next button, it will think that the survey is completed and close the survey. If this happens and you need to go back, just reach out to your quality advisor and they'll be able to engage our analytics team to reopen that survey. But again, I caution you, when you get to the last question, before you click next, you might want to review and make sure you answered all the questions in their entirety. So when it's complete, a couple things will happen. In the HSAG HQIC dashboard, you will see some radar graphs with your results. We'll be able to track over time as the radar graph fills out your improvements that you've made in each of the 4 topic areas. In addition, you'll have another line that will show you HSAG HQIC aggregate results. So you'll really be able to compare yourself over time and to what's happening at the entire HQIC level. And then again, you'll be able to meet with your quality advisor and we'll go over the results and the scores with you and really help you and work with you to devise a plan to improve those areas of culture of safety. And that's the end of our presentation. If you have any questions at all, you can contact your individual quality advisor or you can email us at hospitalquality@hsag.com. We thank you for your time in performing this important assessment, and more importantly, we thank you for your commitment to patient quality and patient safety as you join HSAG HQIC in this important initiative. Thank you so much and have a good day.